Let's bring in Dr. Ashish Jha. He's the Dean of the Brown University School of Public Health. Dr. Jha, it is great to see you. I'm just imagining a young mom with a 6-month-old in her arm watching that piece and wondering, like, should I get it or should I not get it for my child? People want to know what the data is. We said consult a doctor. Okay, we'll consult you. What kind of advice would you give to that mom?
Yeah, so good morning, Hoda. Thanks for having me here. I would say, first of all, let's look at the data. We have not seen the data out yet. We will see that in the next couple of weeks. The FDA Advisory Committee, if they vote to support making that authorization, I think it'll be based on the fact that it's clearly going to be safe and effective. It has to be. Otherwise, the Advisory Committee is going to turn it down. And I'm also going to look to America's pediatricians, the people who take care of our kids, to see what their advice is. I expect this to be authorized, but we'll have to see what the evidence is, and we're really going to want to be guided by that and by the advice of the doctors.
Well, let's say the data does say that it's effective. Even in kids 5 to 11, only 29% of those kids have gotten one dose. So the data we just showed that most parents of younger kids than that are either on the fence or would say no. If it is proven effective, how could you even begin to convince those parents that it's a good idea?
Yeah, it's a really good question. You know, I have a 10-year-old who's been vaccinated, and I am thankful for that. And the reason he was because the evidence was so clear. What I would say to parents, and what I say to parents all the time, is look at the data. Talk to your pediatrician. For me, the evidence is very clear. Kids should be getting vaccinated against this disease. But if you have questions or concerns, there's nobody better than your pediatrician or family physician to give you the advice about how to best take care of your child.
And quickly, Dr. Jha, let's just hit on masks for a second. I feel like COVID numbers are dropping. Things are trending in the right direction. There are lots of still mask mandates all around. Do you think it's time to relax some of those mask mandates given the numbers?
Yeah, Hoda, it's a great question. I think as numbers come down, I don't know right now would be the time, but I think in the next couple of weeks, if infection numbers keep doing what I expect them to do and they get very, very low, I think it's completely reasonable to relax mask mandates for everybody. And I expect a lot of states will do that.
Okay. All right. Dr. Jha, thank you for your expertise this morning. We appreciate you joining us.
Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.